Well, hello, good afternoon, good evening, and good morning somewhere out there in the world. Happy Saturday. And of course, it's 12:30. What are we going to lunch today and or eat? And what are we going to learn today? Well, you guys know that I'm all about some real talk, all right? But most of all with real people about some real issues. And we are going to be learning something today. And I hope that you have some pen and paper handy so that you can take some notes. I'm actually thankful for our guest today that out of her busy schedule, she made some time to come on again. She actually joined us yesterday um, on Nuestra Comunidad with E.V.E and Juan. And so I'm thankful that she is coming on again today because we have different platforms here. And of course, she is Dr. Amira Muhammad. And I'm just, I'm multitasking. When do I not multitask, right? So I want to bring her up in a minute. And first of all, we don't know everything, do we? No, we don't. We don't know everything, especially about our health, about our bodies. We have to learn about our bodies, people. So I'm going to bring her up. Dr. Amira Muhammad is from local Northwest Indiana, and she is a powerhouse, and I'm so grateful for what she's doing. So let me bring her up without further ado. Welcome, Dr. Amira Muhammad. How are you?
I am good. How's everybody? How are you?
Wonderful, with the exception of a little bit of technicalities that got us started off a little late, but it's okay. They say delayed is not denied, but we are here and we're going to learn a few things. Some people did join us on Nuestra Comunidad NWI, the other platform, which is the radio station on WLTH. I come on with my co host Juan at 5 p.m. on Fridays and Saturdays at 10 a.m., and that's Central Standard Time. And of course, this is reaching out to a different gamut of people. We are live on YouTube. We are live on Stitch TV. We are live on Facebook and on my LinkedIn as well. So, my LinkedIn people, my family on LinkedIn, we're looking at professionals and talking to them here as well. And we have a professional and expert here this morning, this afternoon. Depending on what time zone you are watching us from. And if you're watching from another country, it could be evening, right? So, welcome once again, Dr. Amira Muhammad. How are you? It's a beautiful weekend, and you could be doing something else, but you chose to accept my invitation to come on this show.
Oh, my pleasure. My pleasure to be here.
So, because there's probably a lot of people that did not hear the show yesterday, tell us a little bit about you. Who is Amira Muhammad?
Um, Amira is a human, simple human who loves to educate people and to just spread awareness and to live life and be useful. So, anyways, I was born and brought up in India. I've been living in the United States since about 27, 28 years. And I'm married. I have 5 children, 5 boys, and busy schedule. Love what I do. And I am a physical therapist, and I and that's been my passion to work with people that have this condition. And I'm also a vocalist. That's the other side of me, but we're
Oh,
going to
is
focus
that
on
is that the side?
Lymphedema.
Is that the sidekick, the vocalist side?
Yes, yes. I'm a
Oh, I did
professional
not know
vocalist as
that.
well.
Oh, you're gonna have to
Yes,
perform for
yes.
us one day. Wonderful.
Of course, we'll do that one day. So,
Definitely, definitely. And so she is a professional. She's dealing with bodies, dealing with all sorts of sizes of bodies, right? You said
yes.
you're a physical therapist, so you see a whole lot of different people, all different
Oh,
sizes,
yes.
clients,
Yes.
right?
Yes.
But there's something that sticks out, which is one of the reasons why we're bringing you on because we don't have enough awareness of everything. We talk about Diabetes Awareness Month, we talk about Alzheimer's Awareness Month, we talk about Cancer Awareness Month, but there's something that you brought to my attention that caught my attention actually. And I said, well, there's not a lot of people that know because if I don't
That's
know,
right.
I have a big mouth, then a lot of people don't know about this awareness. I've heard the name, didn't know what it looked like. So, first of all, what caught your attention in the topic that we're going to talk about, which is lymphedema?
Yes. So lymphedema was something that years ago, one of the hospitals that I worked with, they brought me this information and said, "Hey, this is a condition that would you like to learn about it and participate on a seminar?" So I said, "Absolutely. I'm always open to learning." So this was in 2004, probably 2003, almost. So I agreed to go learn about this condition. My eyes were like, I couldn't believe it. And then I brought back those tools that I learned in a weekend course to my clinic and to the hospital clinic I was working for at that time. And I got amazing results. So basically, the condition is called lymphedema, which is abnormal accumulation of lymphatic fluid in the body. So you may ask me, what is that? What is lymph? A lot of people have heard of lymph nodes, right? Like everybody knows what lymph nodes are, but nobody knows exactly what we are talking about. So our body has a circulatory system, and I would say lymphatic system is a subsystem of the circulatory system. Circulatory system is like your heart pumps and your arteries carry all the blood, about 20 liters a day, to your body tissues. And then about 17 liters of blood is carried back to your heart and lungs to get the oxygen back on it. I'm going to say it in very lay terms, basically. So the 17 liters comes back, but what happens to the 3 liters in a day? So those 3 liters becomes lymph in your body tissues.
Mm,
So it's a colorless fluid. It does not have red blood cells. It's colorless. It has protein molecules. It has fat cells. It carries immune response cells, your WBCs, those
mm,
kind of things, and the extra fluid that was left in the body tissues, which is about 3 liters a day, which is about
mm,
15% of your body fluid. So if your lymphatic system gets disrupted, it's all over your body. Your lymph system is everywhere in the body. Okay. So that those lymphatic ducts, those little capillaries, if they are backed up in some way, um, you can have swelling in your leg, in your arm. It can be anywhere in the body, but lot of people that have a very difficult time with the leg lymphedema,
mm.
because you walk on your legs all day, and if your legs are heavy, swollen, hard and numb, what are you going to do? It's going to be really hard for you to move, right? So
Right.
leg lymphedema is pretty bad, so with a lot of patients. So why what is so there are two categories of this lymphedema. One is primary lymphedema, and the other one is secondary lymphedema. Primary is when you're born with it. Genetically, you had it by birth, and your lymphatic ducts were not working correctly from birth, from genetic issues. So then some malformation. So that's primary. And then there's secondary lymphedema. So 10% of all lymphedema is primary, 90% is secondary lymphedema. When you say secondary, it means like it's acquired. It came from some other cause, meaning it can be from cancer, it can be from any injury to the lymphatic system, any surgery, cancer treatments like your radiation, and it can be from veins being backed up, venous insufficiency, we call it chronic venous insufficiency. It can be from obesity. So it can be from any of these reasons that your lymphatic
Mm.
system is disrupted. So about 22% of all cases of our non-cancer related lymphedema, 22%, and 68% is cancer related. So
Wow. Did you
keep
say
in mind,
60?
68% of lymphedema is cancer related. And then the other thing that I have noticed as a woman, like lately, it's coming a lot of, I've seen quite a few patients lately, post gynecological procedures or gynecological surgeries.
Hmm.
Gynecology, yes. So about 50% of gynecological cancer treatments can lead to lymphedema. So 50% is a large number. So keep that in mind.
Yeah, I
Yeah.
did not know that. I did not.
Yes.
Wow.
Yes. Yes. So what else can we talk about? We can.
Wow.
Oh,
So,
I want to tell you one more
so
thing. One more thing.
yeah, yeah, yeah. Go
Five
ahead.
to 8 million Americans suffer from lymphedema. That's the number that has been already diagnosed, but there's so many people that are not being diagnosed. So your numbers would be higher if everyone is being tested, which we don't have a lot of awareness, so we don't test people.
So, when should a person test themselves?
Mm, testing is very limited, actually. There's so if you see right now, it's like you see symptoms. You see like, oh, you're, I mean, you're swollen, fluid retention in your body, you go seek help, in my opinion, right now. Because there's tests like bioimpedance, lymphoscintigraphy, it is not commonly done locally. Like there's not many hospitals in Northwest Indiana that do lymphoscintigraphy. You have to go to University of Chicago. You have to go to Northwestern. So it's not, yeah, it's very limited right now. So um, I
Why
can't
do you
even
think that
say.
is? Why do you think that is,
Okay,
Doctor?
any condition, anything is funding, correct? Anything. We get, if you don't have enough funding for any cause, nobody's going to test it.
Hmm.
So right now, I feel like lymphatic disorders, lymphedema, all these disorders are not given the forefront that they deserve, because it's such a debilitating condition. It disrupts your quality of life. Like people are homebound, like they're not able to get out because their leg is swollen. And if they not get treated, they have like oozing liquid coming out of their legs or any body part. They get recurrent infections, they get cellulitis. So all these things happen. So it's very sad. It's a tragedy.
So then, let's just say that I started seeing some dry skin on my feet. Is that something, and some swelling? Is that something that should alarm me, or I should
I
do
should
something about it?
definitely go to my doctor. Yeah, I would go to my doctor. And the other thing, recently, not recently, most of the course of action that a lot of primary care people do is like they put them on diuretics. And the next thing is like people are just taking those water pills and like, oh, my swelling will go away. So sometimes I would go further. I would ask questions. I would say, could this be, hey, I've had this swelling for over 6 months in my legs or my arm. My one arm is bigger than the other. My one leg is bigger than the other. It looks really big.
Mm,
Can you please send me, could it be lymphedema? Ask questions. Be proactive in
right.
your care. Don't just follow. Sometimes, well, don't we say that squeaky wheels get the first,
Yeah. So if you're
right? So
squeaky, you
please
got to pay
ask.
attention to that, right?
Please ask. Yes, please go ask your doctor. Say, hey, could this be this? And all they can say is no. They can send you to somebody, right?
But at
So
least you get that out of the way and rule it out.
exactly. Rule it out. Rule it out. Exactly.
Wow.
Yeah.
And what you were saying, blockage of the lymphatic vessel leads to the fluid retention. So
Exactly.
how can I doctor? Is it possible to avoid thinking that it's water retention, because people that have hypertension, they tend to swell up, or people that are
Yes.
diabetic, they tend to swell up, and then they're given water pills. What if it's not that? What if it's lymphedema? Can it be
Yeah.
misdiagnosed by any chance?
So you can have a combination of both too, right? You can have, a lot of people I know have comorbidities, meaning like they have high blood pressure, they have heart issues, and that can also retain water. You can have CHF. But again, when you go see an expert, when you go see somebody, that's when you'll get your answers. You want to go see somebody. You want to make that appointment, or and say, hey, could this be this? And that's when you would know.
And you were showing us some pictures yesterday, and I just came up with one, and this may gross you guys out, But when you see people with legs like this, and I've seen them like in Mexico, um, and I don't want to say in the poverty areas, but when they're not treating themselves, they pretty much, because they don't have the funds to do so, they don't have the means, there aren't many doctors that they could see, they don't have health insurance, that you may be seeing this, and it may gross you out, guys. This is
Yeah.
just one picture, but I'm going to pull up the one that you shared with me yesterday, Dr. Amira. And I don't get grossed out, but it's not a pretty sight to see. And I guess the first sign would be what? Just the swelling? Is that would be the first
Yeah,
sign?
your ankles will swell up first. And then the first, so there's stages of lymphedema, there's stage 1 to 4. One being you had like a little bit of swelling in your leg, you elevated it, you went to bed, you woke up next morning and it's gone. So then you have this, and then maybe a few years later, maybe a few months later, you start noticing that the swelling keeps coming back, recurrent swelling in your legs, and it becomes more hardened. The tissue gets like really hard, like almost leathery. So then you know, if you feel like your leg is, or your arm is, or your neck is really hard and leathery, then you know you have to seek help. That means like you're past the reversible phase. Like stage 2 is reversible, where like you have a little bit of swelling, it's not going down, and your doctor or your practitioner, whoever you see, recommends, hey, you have to start wearing compression socks. So one of the treatments, first line of treatment that we tell people is elevate your legs, wear compression, and if it gets reversed at that time, great. But if not, you have to seek somebody that treats lymphedema, so that they can help you manage this condition with the treatment that they offer. It's called complete decongestive therapy, and the gold standard of this treatment is has four sections, four parts to it. Part one, manual therapy. We manually, the trained professional manually move the fluid to other healthy lymph nodes. We'll teach you how to do that at home as well. They
Mm,
will they will wrap your legs sometimes if the swelling's really bad. And before we recommend compression socks, we use what we call multi-layer compression bandages that we wrap people's legs with, so that they can get stabilized, where the swelling can go down to a certain level. Then your compression garments will fit you better. So that's step 2. And then we teach you how to take care of the dry skin. There's always dryness in the skin associated with this. So we always recommend people to start using uh, balanced pH lotions like Eucerin, Lubriderm, Curel. These are the three. Sometimes CeraVe, I've heard of CeraVe, Cetaphil, those kind of things are pretty good. Thick lotion that you can
right.
apply. Yeah, and then number 4, really important thing is exercise. So sedentary lifestyles, keeping your body from moving, can cause swelling. Can So if your muscles don't move, your lymphatic system, first of all, your lymphatic ducts and capillaries do not have a mechanism to push the fluid up
Mm,
to where it should go and join the regular circulation. So the only way that the lymphatic system functions is by the skeletal muscles, the muscles that are around your body. When you move those muscles, you can move your lymphatic fluid. So basically, you have to move. Do exercises. We teach what we call decongestive exercises. They're in a certain sequence. We teach those exercises. But any large muscle group exercise, walking, but make sure you wear compression when you walk, because anytime you put your leg down, dangle your legs, and stand on your legs, you are um, gravity brings the fluid down, right?
mhm.
So you need something to push that fluid up. So what are you gonna do? You have to wear compression. So wearing compression while you stand and walk and do exercise is the best way to help your fluid moving, get to move your fluid. Yeah.
So is that to avoid getting lymphedema, or that is somebody already that's been diagnosed with lymphedema?
I would say both. Like, if you have if you're a stage one, when you have a little bit of swelling that comes here and there, and you start doing these things, you're gonna prevent going to the next stage,
Mm,
right? And you have
right.
lymphedema, so then you need compression, you need all those things. So, and you still do these things, the same
Mhm.
steps you do, but you need help. You need outside help. You need someone to help you. You need a clinic that specializes in this to take care of it, because at that point you need a it's no longer reversible by yourself. You need outside help. You need your family to help you too. So a lot of times I always involve families. I always, if a wife is having lymphedema, I involve the husband. I'm always telling them, hey, bring your husband for one session. We always educate people, the families, because without your family's help, you're not going to be able to do it all yourself. You need to ask for help. That's another thing we have to do. Ask for help. Bring your family in. Take the support you can. I know there's a lot of people that live alone. Like we do, I always remember that we need to get help that we need. Maybe your neighbor, I don't know, maybe your cousin, I don't know, maybe your significant other, your boyfriend, girlfriend, whoever uh, can help you
Mhm.
somehow, little bit, whatever you can get help. Please take that help and ask for help. And having said that, I also feel like there's so much gap in care. Like we treat patients, we send them home, and a lot of times these patients do not have help at home. They don't have anyone to help them wrap their legs. So
Right.
eventually, I would love to work on, work with whoever I have to work with to bring that extra care. Like, I know, like Northwest Indiana Community Action Corporation, those kind of organizations help people provide in-home care for people. But I don't know. I don't think they have a program. None of these organizations have any program that helps the lymphedema patients. There's nothing right now. Nothing in
Yeah,
our
I
state.
haven't heard. I mean, you are the first that I'm hearing it
Yeah.
from. I have heard the name lymphedema before. I just didn't know what it looked like, and I thought,
Yeah.
well, maybe that's cellulitis, right? But can it start out at lymphedema and go into cellulitis,
Oh,
or the other way
absolutely.
around?
Absolutely. Yes. So, one of the risk factors of lymphedema is cellulitis and recurrent hospital admissions. So, what happens? People, when they don't get diagnosed with lymphedema, they just keep getting the cellulitis in the leg. They end up in the hospital. They they are hospitalized. Look at the cost it puts on the system, on the healthcare system. Somebody being Isn't it better for someone to be treated as an outpatient, get better and go home, versus being admitted to the hospital?
Right, right.
Right, that's thousands of dollars for per their admission. That's a lot of money.
That's a lot of
So
money.
we are straining our own hospital systems and our own healthcare by not taking care of these things. So it needs a huge
Especially, yeah,
overhaul.
especially if you're not aware of it, you don't know what it is. But if you see something that's not normal, go to the doctor and
Go to the
ask
doctor.
questions.
Exactly.
Don't
Exactly.
be, sometimes the ego gets in the way, especially men. Men don't like going to the doctor, or they'll
Oh
say they're
yeah,
fine until they're dying, and that was a little too late,
that is
and I
true.
hope that some men are watching, because this can happen to you. It's not just women, it's not just heavy
Oh,
set people,
oh,
but thin, right?
yes, of
Thin
course,
people.
absolutely. Anyone.
So
Chronic venous insufficiency, if your veins are backed up, your lymphatics are backed up as well. So seek help.
I've seen that. I've seen that where the veins are so visible, the feet start to get discolored. They start to look
Yes,
purple, reddish. Is
yes.
that what
It,
that is? I mean, I've
yes,
seen
it's
that. I'm
hemo.
thinking it's
It's
just the
called
veins.
the discoloration in the lower leg from the veins being backed up is called hemosiderin pigmentation, and that is and then you can have lymphedema side by side with it. So it can be both venous insufficiency leading to lymphedema.
Mm.
or lymphatic backup leading to venous insufficiency. It's like they go hand in hand.
Well, you guys heard Dr. Amira. This show is only 30 minutes long. We have a few minutes left, but she's also promoting this, bringing awareness, which is what we're bringing here, awareness. We're real talk. Okay, these are real issues, people, that many people are suffering from this. That now I
Yes.
did ask yesterday, is it painful? I mean, I'm looking at these pictures.
Yes.
It looks
Yes.
very painful.
Yes. It is painful. It's called, I usually my patients tell me it's a heavy, numb feeling. It's like in some
Right.
stages it's very painful, but when it comes to when they have gone past, when the skins become already like dark and like this, you've seen the bark light, right? At that point they probably are not in pain at all. But the other initial, the stages where like 2 and 3, it's pretty painful. And then people can have wounds from that. Like you have open wounds from, you saw a picture last time I showed you with a big,
Yeah.
with the open wound and the dry skin. Yeah. And that's very
Yeah.
common. Yeah.
That looks like I was saying yesterday, looks like an elephant's foot.
So
This
yes, elephantiasis is also a form of lymphedema, but it's in underdeveloped countries. It's caused by a bacteria. Okay, so we don't have that kind of um, lymphedema here. It is in India, in other countries that I know of, Africa, tropical countries. There is elephantiasis. It's the same thing that happens, but it's caused by
mm.
a bacteria. So it's from water. Drinking that water with that bacteria in it, they get the same lymphatic elephantiasis. Is that? That's exactly what it is. Yeah.
So if they have these symptoms, the signs are right there. Do they just go see their primary physician, or is there a doctor that's going to? Because yesterday you said that you have to be a lymphedemic certified or something like that.
Yes. So you can go to your regular doctor um, and tell them and ask them, could it be lymphedema? You can Google search it too nowadays. Like you can find me on Google, like locally. So you can. I have people that just call our office and ask us questions. Hey, what about this? And then they stop by, pick up a brochure, and they come talk to us, which is fine. But yes,
And you
please go
guys,
talk to the primary. Sorry, what?
no,
So
no,
sorry.
go ahead. Go ahead. Sorry. I know
We
you're
You can
having.
talk to your
I'm hearing
primary
you break up, but go ahead and get to your primary physician. But also for more
primary.
information, your primary
Yeah, talk
physician.
to,
Also,
yes,
for more information, you can seek Dr. Mira, and the
yep,
information down here. That website that's there is going to take you for more information about lymphedema. Is that right?
yes,
That
and you can call that number as well, the 501-1856. It's my office cell phone. So, and you can text me on that. I'll respond to you.
so we have a big event coming up on Monday. We have a few minutes left. What's
Yes,
taking place on Monday? Tell everyone. We're inviting you
we
all. Come
have,
on.
it's a World Lymphedema Day, March 6th. March is a Lymphedema Awareness Month. March 6th, we have a World Lymphedema Day celebration. We have a walkathon, a 3K, and we are doing it in Maryville, Indiana, Dean and Barbara White Community Center on Broadway, 6600 Broadway. It's at 6 p.m. And please come register, join us, walk, and get more information from us.
Right, right. And I will be posting the link on all of our platforms that you're watching us through from Twitch TV. Shout out to you guys that are watching on Twitch TV, also on our YouTube channel, on our my LinkedIn page and my Facebook pages as well. We appreciate you coming on and watching this show because it is real talk with real people about real issues. And this is an issue that maybe you don't even know you may have it or someone you know. It's always important to look for signs. Not that we're looking to see if we're sick. It's just you just never know. And this could be something that can be detected at an early stage. You did mention that it's not treatable. It's curable. It's not curable, but treatable. Meaning
Yes,
once you
yes.
have it, you
Like
can't
it
get
can be
rid of it.
managed. It can be managed. Yeah, we have to
Wow.
manage it like just like we manage diabetes, high blood pressure. You take medication then to maintain where you're at, and that's what you do. You manage it.
Wow. I thank you, Rosie.
Thank you.
This show is what it's called, real talk. And we're bringing some more experts here. We got a lot to learn still about our body, about ourselves, mind, spirit, and body. And we just got to keep bringing things here on the show so that you guys can take note of what is taking place with you. And thank you, Dr. Amira, for coming
Thank you
on this
so
show.
much.
We look forward to seeing you on Monday. I don't know if
Yes,
I'm going to walk fast or I'm going to jog it, but you take your time. It starts at 6
that's
p.m.
right.
And where is it once again, Dr. Amir?
Dean and Barbara White Community Center, 6600 Broadway, Maryville, Indiana.
Wonderful. So I'm going to share it on the comments as well. The link for you all to register. It's only $10, but the information that you get, and most of all, the walking. We got to invest in ourselves, people. We really do. And if we are not taking care of ourselves, no one else is going to. That's for sure. Right.
True.
So with that, you guys have a safe, wonderful weekend. Hit replay if you just joined us, and you can watch this again. Thank you so much, Dr. Amira. You
Thank you
have a
so
great
much, Eve.
weekend.
Thank you for
We'll bring
having
you
me.
back soon. Thank
Thank you.
you.
Have a
Bye.
wonderful day.
Thank
Take
you.
care.
You as well. And well, that's it, guys. That's a wrap. More information to learn from. How about that? Didn't mean to gross you out with the pictures, but just wanted you to know what it looks like because I sure didn't. So, with that, guys, I do have to go as well. As I always say, got to go. People to see people, or places to go, people to see, and things to do. There's always things to do. On that note, I gotta go, guys. So thank you so much for joining me here. We'll be back on Wednesday Lunch and Learn at 12:30. Some more wonderful guests that you'll learn the great things that they're doing in the community for you. Peace to you. God bless. Nos vemos. See you.